So right now, we're going to give our patient medications through our NG tube. The first thing, just like always, we're going to start by checking the patient's orders from the physician. So it looks like our patient has ordered Lasix as well as Depakote. So we have those two medications. The next thing that we're going to do is go in the med room and we're going to prepare our medications. So the first thing we're going to do is take our medications. Start with our first med check out of the Pyxis. So we have Lasix 10 milligrams per ml. And then we have Depakote 250 milligrams per 5 ml. It looks like our patient was ordered 50 of Lasix and 250 of Depakote. So we'll need to measure that out. The second med check is going to be when I am pouring the medication into the med cup, making sure to keep the cap up and the label in my hand. So I'm going to pour 5 mLs. Getting down to eye level to check out the medication level. So we have 5 mLs of Lasix. And then we're going to have 5 mLs of Depakote. Getting down to eye level again, checking to make sure we have the right amount. The next thing I'm going to do is head over to the patient's room. I'm going to perform hand hygiene. And I'm going to put on gloves. Going into the patient's room, I'm going to introduce myself and ask the patient for his name, date of birth, and any allergies. He tells me his name and date of birth, and he doesn't have any allergies. The next thing I'm going to do is any pre-assessments prior to giving these medications, such as vital signs or anything, or checking any labs before I give these medications. Then, since he already has the NG tube in, I'm going to do an abdominal assessment just like I did prior to putting the NG tube in. So we'll start and let the patient know I'm going to listen to his stomach. We'll start in the right lower quadrant, checking all 4 quadrants for bowel sounds. And then I will also lightly palpate, checking for pain or rigidity. And the patient's not feeling any pain. I also want to check to make sure that the NG tube is still at the same spot with the indelible ink that it was when it was inserted. And then last but not least, I'm going to check for gastric residual volume. So we're going to do that by taking our syringe, inserting it into the NG tube, and we're going to be pulling back the gastric contents. As we're pulling back the gastric contents, we're checking for the volume. We're also checking for color. So after we pull back, we can insert it into our container. And we're going to do this until there's no gastric volume coming back. And it's important that you check with your hospital's policy as to what they consider excessive. And if it's excessive, we're going to want to hold the medication as well as hold the gastric residual volume and contact the physician. So our patient just had his gastric residual volume, and it's not considered excessive based on our hospital policy. So what I'm going to do is return that to our patient by taking the plunger out of our tube. And I'll give that right back to my patient. And then after we return the gastric residual volume, we're going to need to flush the NG tube with 30 cc's of tepid water. And then we flush that for our patient. And before we give any medication, we need to do our 6 rites of medication. And then our third check of medication is going to be me scanning the patient's band and scanning the medication. So I'll scan the patient's band. I'll ask him for his name and date of birth again, as well as any allergies, and he doesn't have any. And then I will scan the medication. Get all my medications prepared. I will take his NG. I am going to do this by gravity. So I will insert my syringe, First here I have his Depakote. I explained why he's getting the Depakote. I did any of my pre-assessments and I listened to his abdomen. I'll pour the medication in the syringe. In between each medication, we're going to flush the NG tube with 30 cc's of tepid water. And then we have our Lasix here. So I'll pour that in. We're going to flush with 30 cc's of tepid tap water, 30 to 60. And since that is complete, we can hand our patient a call light, make sure he's in a safe position, and then come back and check on him within an hour. And keep him the head of the bed elevated for 1 hour after the medications just to make sure that doesn't come back up the tube.